Hello, folks. This is your host, Dr. Graham Taylor. I'm so excited to tell you about the upcoming Triad Mental Health Summit Week, taking place online August 20th through the 22nd. This 3-day event is free to attend and will cover different themes each day: positive change and equality on the 20th, simplifying the pathway to licensure on the 21st, and elevating therapeutic skills on the 22nd. Join us for one day or all three to gain valuable insights and practical knowledge that will help you in your professional growth. Both Charlene Dixon and I will be hosting live interviews, and we'll even have time at the end to field questions from our audience. Don't miss out on this incredible opportunity. Learn more and register today at triadhq.com/TMHS. We look forward to having you there.
Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Dr. Graham Taylor. My guest today is Chris Wolfington. Chris is the founder and chief revenue and strategy officer for FinPay, a patient financial management company that is committed to solving the affordability crisis in our healthcare system. Chris brings over 32 years of experience in payments, healthcare, technology, and financial services. With a keen sense of leadership, he has utilized his passion, energy, and capital to lead numerous businesses, including 2 public companies within the payments and financial services sectors. Chris is dedicated to leveraging his expertise to drive innovation and positively impact these industries. We're excited to have Chris with us today to discuss FinPay and the work they're doing to enhance patient financial management through advanced technology and best practices. Chris, welcome to our show.
Thanks, Graham. Appreciate it.
Nice to have you here. Yeah, man. Well, so the dysfunction of medical costs and healthcare billing practices, the often lack of cost transparency, financial literacy, and the affordability of payment options, you guys have found at FinPay an opportunity to be of help to both admissions teams, the providers, and also to patients. Share with us, Chris, if you would, about the formation of your company, FinPay, and your mission.
So our mission is really simple: that we can restore confidence and trust in the United States healthcare system by being more intelligent, more upfront, and more transparent about cost with healthcare consumers.
Yeah.
And empowering the provider to do that through automation and technology. And so that people aren't afraid to have financial conversations about the cost of healthcare. It's the huge pink elephant in the room. Everybody knows it's there, and nobody wants to talk about it.
Yeah.
But I think to understand the solution or where it's going, you have to understand how we got here, right? So 10 years ago, and it's game of business trends, 10 years isn't a long time, right? I think we can agree with that. And there's been 3 colossal changes in this part of healthcare that all happened within the last 10 years that have contributed to this problem. So let me tell you where it started. It started because more than 10 years ago, nobody cared if the patient paid their bill. I'll just be blunt. I don't know how many providers would say that out loud. I don't know how many payers would say that out loud, but in private rooms, they all agree to it. I start out my conversations with my potential customers that way. Say, one of the reasons you have a difficulty solving this problem is you never cared if they paid. The insurance covered 98% of the bill. The patient only owed 2% of the bill.
Right.
Would you annoy the patient and maybe risk them not coming back to you over 2% of the revenue? No, you wouldn't do that.
Yeah.
What the ripple effect of that was, Graham, is now the vendor community, the technology community that these providers for solutions. Well, if you own a technology company that either does revenue cycle or electronic medical records, or in some parts of healthcare like behavioral health, they use CRMs. Are you going to spend a dime of your resources in technology development building features and functionality around a part of a business that neither the patient nor your customer cares about?
Right, exactly.
No.
Yeah, exactly.
And if you're the provider and you don't care about this 2% being paid, are you going to go out and hire people that are subject matter experts on how to talk to a patient about cost. No. So
Yeah.
fast forward 10 years, a couple things have happened. You have the reimbursement rates have come down as the payers try to get healthcare costs under control. At the exact same time that the percentage of those now lower rates that the patient owes directly has accelerated by immeasurable proportions. We're not talking about 20% or 100% growth. We're talking about the patient now can represent 20 to 25% of all the revenue a healthcare provider is entitled to.
That's huge.
And I don't know how many businesses, Graham, maybe you can answer this question. How many companies or industries are you aware of that 25% of the revenue that's generated by that business or industry goes unpaid and they can continue
Yeah.
to be sustainable?
Not today. Yeah. It's
Well, it's
impossible.
mathematical. It's economics 101.
Yeah.
You can spin that all you want. It's the fundamental law of economics. GAAP revenue is great. Accrual revenue is great. Look how much I'm owed. But if 25% of your revenue goes unpaid, you're not going to be a sustainable business.
Mhm.
So then what else happened? You also had all these, a lot of consumers will recognize things like the No Surprises Act and balance billing or surprise billing and things of that nature.
Mhm.
So the federal government and all its intelligence says, well, let's force the providers to be transparent about pricing. You have to put your charge master on your website so patients can get an idea what services cost. Well, you just threw gasoline on a fire. So in an effort to help the patient, you've actually, in my opinion, created more havoc and confusion.
You bet.
And I'll use a great metaphor, believe it or not, that's very closely related to healthcare. It's the car industry.
Mhm.
And you're probably thinking, what does the car industry have to do with healthcare? So one area there's a connection is every car has an MSRP, right? The MSRP says the manufacturer's suggested retail price. That's what that stands for. Of the car. Do you know anyone that's paid the MSRP?
Yeah.
Have you ever
Yeah.
paid, Graham, the MSRP? So isn't that a number that's sort of irrelevant?
Mhm.
So if you tell healthcare providers to put their MSRP on their website, the only thing you've done is scared away patients from getting care that they desperately need. Now, this is my opinion,
Mhm.
right? Because healthcare providers, their charge master is their billable charges for services rendered. Medicare and Medicaid don't pay that rate. They pay a percentage of that rate. And because most healthcare institutions have managed care agreements, they're in network with different payers. They have contracted rates that are nowhere near that billable rate. So here
Mhm.
these unsuspecting consumers are going and looking at cost on
You bet.
providers' website, and those costs
You bet.
are nowhere near what the real costs are. Not only mention that, nowhere near what amount of money the patient's actually going to have
Yeah.
to pay out of that dollar. So that's where we started from. That's where all the chaos and confusion is. So now let's layer that in another layer. There's compliance ramifications. If you're in behavioral health, for example, specifically substance abuse, there is now a law that says you are unable, it's no longer a civil penalty, it is a criminal penalty, if you reduce the out-of-pocket costs to a patient. It is a criminal offense. And you can get jail time and
Mhm.
fines, criminal statutes. It's called ECRA, Elimination of Kickbacks and Recovery Act. And it layered in a whole new, now anyone that's been doing Medicare, Medicaid has known that this is a law for quite some time. What this law did, it extended it to commercially insured patients, not just CMS related care. So that's a lot of words I just used, right? So we have compliance issues, we have financial issues, we have lack of subject matter experts working in these facilities. We have vendors that didn't build any technology or components. And now the problem's gotten bigger while all those other things
Exactly.
exist. And providers are scrambling to try to figure it out.
Yeah.
And that's where the problem came in. Patient financial management as a discipline And let me define that so it's clear to your listeners what I mean by patient financial management. It means, what are the tools, workflows, and standard operating procedures that a facility uses to manage the economic and compliance risk associated with money that the patients owe them directly?
Hmm.
So deductibles, co-pays,
Right.
co-insurance, or
Right.
even self-pay patients that are paying cash for their care. So patient financial management is a relatively new discipline, and FinPay has come up with a creative solution to provide automation and technology. So not only can providers get paid the money they're owed for the services they've rendered, but we empower them to do it in a very patient-facing, patient-centric way
Yeah.
so that the consumer feels that the provider is helping them break down this affordability barrier to care. At the same time, the provider is able to be compliant. Does that make
Yeah,
sense?
it makes great sense. And I appreciate the kind of historical, walk down memory lane here about how did we get here. I think that's a very, very critical piece here. We've actually conditioned, like you said, and taught people how to think about copays and who would once upon a time put resources into the 2% that wasn't being paid. And patients would say, well, it's 2%. I'm not going to pay that, or whatever they would, take a stance in. But when it gets up to be, 10, 20, 30% of the payment, businesses can't continue like that. And people also at the same time need to be responsible. But, I know some of the stats too, 50%, according to a Kaiser report, of patients' delay in paying medical bills is due to the high deductibles and the confusion over costs. And the SAMHSA reports, saying something on the other side where, it states that 39% of admissions are going to be lost due to the mishandled or absent financial conversations. So getting paid as a provider and the affordability barrier in obtaining healthcare for patients on their side are always going to be challenging issues in this healthcare system. And to address this, you guys have two, the kind of two key issues. You guys have a couple of, we got a number of programs, but two really stood out to me. The Fin Advisor, which provides admissions teams with the actionable intelligence that they need to assess economic and compliance risks before the patient's even admitted. And then on the other side, the FinPass is designed for the patient side and automates the patient's engagement. And that focuses more on their financial literacy education and some of the target payment rules that they're going to need to be aware of, as well as the targeted payment program options that they've got. And they're wonderful programs. I would love our listeners to learn more about these two, FinAdvisor and also FinPass.
Okay. So let's start with FinAdvisor.
Yeah,
FinAdvisor, they say necessity is the mother of invention. And I actually really believe that.
I do too.
So in FinPay's early years, our electronic medical records platform that we call FinPass that you were referring to, we relied on our customers, the provider, to tell us how much does the patient owe you? And then our system would provide the engagement tools that would allow you to go and engage that patient about costs and get the money paid. But what we learned very quickly is that our customers had no idea what they owed them. So they would say, oh, you don't owe any money, come on in.
Okay.
That's a horrible experience because when you end up getting a bill for $3,500 in the mail, you've just destroyed that patient as a potential brand ambassador or referring,
That's right.
right? I don't know where I'm going if I relapse, or I don't know who I'm going to recommend my family member or friend to. I just know I'm not going to go there or recommend that facility that told me I didn't know anything and then set me a bill for $3,500.
Yeah.
The other way they handle it is they go, oh, your deductible's $1,000. And the person goes, great, here's $1,000, I'll pay it. Well, if I told you your deductible was 1,000 grand and you paid me, in your mind, what are you thinking?
I'm done.
I'm done.
Yeah.
I'm done. And what happens
We're
when the
good.
co-insurance kicked in and you get a bill for $2,500 after someone told you, pay me 1,000?
Mhm.
That's even worse than the first scenario. I feel like you lied to me.
Right.
So what we realized was we needed to build a tool that very simply could automate creating an estimate that had 97% or better accuracy.
Yeah.
And that was our measuring stick. We weren't interested in something, oh, it's an estimate and it's okay if it's 50% accurate or no. Like that's not solving the problem. So we built a very complex tool that was really designed and built over a 3-year period. I kid you not,
Mm.
because kept getting constant feedback and making incremental improvements because we realized there's all these dynamic moving parts. And that's why people that try to do this on spreadsheets and paper, it's literally impossible to do it that way. And you think you're doing someone a favor by giving them an estimate, but when your estimate is 40, 50% off, you've actually caused more harm.
That's right.
So FinAdvisor allows you by simply checking boxes of what levels of care that you're, accepting this patient under.
Mhm.
It'll automatically apply the rate that's most confident,
Mhm.
whether that's your in-network rate or your internal out-of-network reimbursement history, or even FinPay's, you know, network averages. And the algorithm automatically searches which one of those rates is the most accurate for this very specific patient. And it'll tell you what your gap revenue is going to be, and it'll break down, tell you what the patient's estimate is, and it'll even with one click give you a summary
Mm.
of
Mhm.
what that amount of money they owe. This is how much is attributable to deductible. This is how much to copay. This much to coinsurance. So you're empowering the
Yeah.
user
Yeah.
to really have a seamless, compassionate conversation with the patient about cost. Because I don't know about you, Graham, but whenever I call a customer service line, if I sense somebody's doing math on the side,
Mm.
or they're a little less than confident in their tone, it for me it builds distrust.
Sure it does.
Right? I don't believe it, right? And so this tool can deliver this estimate literally in 8 to 12 seconds.
That's
And one of
fantastic.
the other thing that's interesting about this tool is that, especially in behavioral health, a lot of patients before they come to certain providers. So if you're, for example, if you're an outpatient provider, 80 some odd percent or higher of your patients are coming from a higher level of care before they get to you.
Mm.
What that means is all the time, effort, and money that you've spent on verifying that patient's benefits, that VOB is wrong,
Mhm.
because the claims associated with the care that they got before they showed up at your front door
Right.
haven't even been processed through the system yet. So the VOB doesn't know that that care took place.
Mm.
So we actually built in this really cool tool inside FinAdvisor. It's called Adjustment for Prior Care. Does know where they were before they got to you, the patient. So ask them. And when they tell you, I had 5 days of detox and 12 days of residential care, you just click on that adjustment for prior care button, put in the detox 5 days, residential care 12 days, and the system will automatically reprice the estimate,
Mhm.
taking into account the benefit utilization for that
Mm.
care. It even has the ability to automate eligibility for financial assistance and scholarshiping.
Mm.
It's really one and the same, different
Mhm.
places use different terminology. What a lot of people don't realize is under the ECRA law, as much as your intent is good and you want to give someone a scholarship or financial assistance, under the law, you're not allowed to do that unless your ability is standardized without any discrimination to race, creed, color, religion, or people on public assistance.
Mhm.
So what that means is your good intention may end up getting clause claimed back in a
Yeah.
payer audit,
Yeah.
or you're on the wrong end of an enforcement audit. So we've allowed people to put their eligibility requirements and standardize them in our system. So with a couple clicks of a button, you can, in a compliant way, determine who's eligible for financial assistance or not. It's the first step. Knowing what you're owed is the first step to getting paid what you're owed.
Yeah.
You can't get paid unless you understand what you're.
Yeah.
The second thing the tool does, it does a risk assessment and tells the user everything you need to know. Every single provider spends a lot of money to clinically assess the patient. And what that means is, or clinically clear the patient. That means our programs are clinically appropriate for the patient's needs,
Mhm.
but they don't do the same thing financially. Is this patient financially appropriate for your programs? Right? You know, I understand every patient needs to get access to care, but if there's no money, there's no mission. If I don't have a sustainable revenue model, I'm not going to be here for tomorrow's patients.
Right.
So, FinPay design, what are the things that impact the financial integrity of an admission? Number one is AMA risk. What is the financial risk to me if this patient leaves AMA, which means against medical advice? Well, our system will tell you how many days or sessions the patient has to be with you before the insurance even kicks in. And that then can trigger in the system certain down payment requirements to protect the provider.
Got it.
The next risk we assess is called PFR concentration risk. What that stands for is patient financial responsibility concentration. In other words, if a particular provider thinks that Aetna is their best payer and they have an Aetna patient that's coming to be admitted, everyone says, oh, this is great. We have an Aetna patient. Well, not so fast. What if the patient directly owes 30% of all the revenue? And Aetna only owes 70%. Well, that changes the risk profile of that admission, right? You need to pay attention to that 30%. And maybe that triggers
That's right.
some type of rule about down payments or other business rules that the client embeds into our tool. Then we look at sheer just profitability risk. We say, okay, on the screen, here's your gap revenue. Here's how much is owed by insurance. Here's how much is owed by the patient. And then it runs an algorithm based on historical data and says, of that gap revenue, this is the amount you're most likely going to be paid because based on the claims experience with that specific payer and the patient payment experience from other patients that are just like this one you're considering.
Right.
And then gives you a profit margin that you can expect to make. And this type of risk assessment is really allowing providers for the first time to focus on quality of census so they can provide the best care to the most patients and less about just quantity. That may have heard the expression heads into beds. Like that's not good for the patient and that's not good for the provider. Quality of census and referring out patients, or maybe patients with certain types of insurance are going to do better somewhere else. Right. And those other facilities will refer you when they know, and people have this risk assessment, they'll know they'll be able to clinically clear and financially clear patients. So the organization is more sustainable and can be there for tomorrow's patients and next month's patients.
We'll be right back after word from our sponsor.
Most of us spend more time at work than anywhere else doing anything else. So why not spend that time in a job you love? Introducing Triad's Jobs Marketplace, the only job site dedicated specifically to behavioral and mental health professionals. Featuring more than 1,000 open jobs from dozens of behavioral and mental health employers, and searchable by location, professional field, employment type, specialization, and more. Jobs Marketplace helps you find your next career opportunity. Full-time, part-time, or gig time, make the most of your time. To access Jobs Marketplace, register for your free professional account at hellotriad.com/BHT. That's hellotriad.com/BHT, and then click to Jobs Marketplace. If you're already a member of the Triad community, visit app.hellotriad.com/jobs. That's app.hellotriad.com/jobs. Visit us today and take your next career step tomorrow.
Yeah, it's outstanding. Outstanding. I know, and I so appreciate the in-depth and very understandable explanations you're providing us here because they're sensical and they just fit nicely on both sides. You know, for the provider side, that they're not going to have havoc wreaked over, you know, the things they're trying to do, and for the patients to have some understanding. Peter and I were talking before the show today, our executive director here, about how, you know, with any time a patient goes into the hospital or a service, their first thought is, how much is it going to cost me? And then when they're done with the service afterwards, they're thinking about, how am I going to pay this usually? And what am I going to have to pay on top of that? But, you know, I know you guys, as you explained it here, you guys are managing over about 500 million in patient financial responsibilities.
I'm pretty proud of that.
You've got to be. That's phenomenal. And your company boasts some really cool satisfaction ratings, 90% patient satisfaction scores from the patients themselves. a finding that 95% of patients with clear electronic financial records convert to an admission. That's phenomenal. And patients with a clear electronic financial, record pay more than 75% of their total financial responsibility. You guys have got to be proud, like you just said, of this company and what you guys are doing. What kind of feedback are you getting, Chris, from, just directly, I'm curious, from providers? What are you hearing from them, being able to go through what you're providing and making it seamless the way you are? What are you guys hearing directly?
The coolest part about those stats that you mentioned, the clients that we have
Yeah.
that use the technology the way it was designed
Yeah.
with the patient in mind,
Yes.
right? Unfortunately, I do have to tell you, there are people that run businesses where the patient is not who they have in mind.
Mhm.
But those that are patient facing and the patient experience does matter. We are involved at high level meetings and discussions on a regular basis because this is now an important part of their business. It's an important part of their business that for the first time ever, they actually have visibility
Mm.
into the KPIs. You want to hear an interesting statistic, Graham? In 7 years, there's only been one time in an early sort of prospect discussion with a potential customer where I've asked a chief financial officer, hey, how much money do patients owe you a year? And how much of that do you collect?
Mhm.
Only one person has ever been able to answer that question.
Yeah.
And that's not because they're not intelligent CFOs.
No, they just don't
There's
track it.
there's no reporting, no
No.
dashboards, no technology. It's
No.
all done on paper and spreadsheets.
Yeah.
And this is a good segue into the other question you asked about FinPass. So I am proud about FinPass and our electronic financial record strategy, but it really is common sense, right? And here's the best metaphor. Some time ago, it was acceptable for people to have paper charts for patients.
Mhm.
I'm 59 years old. I remember the time you go to the doctor's office and they pull out that big file drawer and
Remember
there are
that.
like thousands of paper folders, right? I mean, today you laugh at that. And that's why every healthcare provider at every area of discipline has, electronic health records.
Mhm.
Some people call it an EMR, some people call it an EHR. You'll probably hear me say both during this conversation. But it's basically digitizing and automating the patient's clinical experience.
Mhm.
This is such common sense today that and I ask this question to providers, hey, if I told you that my proposal to you was to get rid of your EMR and get rid of your revenue cycle technology, what would you say to me? And everyone giggles and laughs like it's such a ludicrous question. And I say, hey, the reason I'm asking is if it's crazy to use paper and spreadsheets to manage the clinical experience of the patient, why are you still using paper and spreadsheets to manage the financial experience for the
That's
patient?
right. Yeah.
And here's something interesting. You probably never thought of this, Grant. The patient's financial experience is 3 to 5 times longer than the clinical experience. Think about it. I'll use behavioral health and substance abuse as an example. My clinical experience starts when I call in about my admission, and it ends when I discharge, which may be 30, 45 days later.
That's right.
My financial experience might go 6, 9, 12, 18 months. And I'm managing it on paper and spreadsheets. And if it begins during admissions and the admissions people are handling some of these conversations, and that changes to people at the facility when they admit, and it changes to people in the back office, the billing office when they discharge. Are you handing people your spreadsheet and your notes that are on pieces of paper to transition? And how do they know what was already done and what still needs to be accomplished? So FinPay simply said, let's create electronic financial records that automate the patient's financial experience. So not only can I do a better job of managing this part of my business, but I can do a better job for my patient.
Mhm. Mhm.
And what I mean by that is affordability isn't the number one reason why people don't pay their medical bills. You want to take a guess at what is? Most people never guess it. A lack of financial literacy around healthcare costs.
Yeah, they don't know how to read what they're receiving, and doesn't make sense. Absolutely.
And it doesn't discriminate.
Mhm.
Does that lack of financial literacy doesn't care how rich you are. It doesn't
Mhm.
care where you're educated, doesn't care where you live, doesn't care what your race is, doesn't care what your sexual orientation is. Financial literacy in healthcare is zero. So we built the platform so that you can target and segment patients into the risk categories.
Mhm.
So we can then provide financial education as part of the engagement,
Yeah.
because people don't pay for things they don't understand. I've been in consumer payments for 35 years. And there's two things I've learned that are the golden rule. Up there goes the balloons from
Pretty
Zoom.
excited.
Never chase money, right? Never chase money. If you're chasing money, you already lost and you just don't realize it yet. Number two, consumers don't pay for things they don't understand. And I always ask prospects the following question, especially if it's a CEO. I say, when is the last time you wrote a 4-figure check for a product or a service that you had no idea what you were buying?
Right.
And I'm quiet. And they'll laugh and they'll say, never. I said, well, why do you expect your patients to act any differently? So any engagement that you have with the
Right.
patient has to include financial education around their healthcare costs.
I think the more we talk about these things, we make it, people sometimes are afraid to talk about what the costs are going to be and everything else. It's almost, we could, if we're talking about behavioral health things, if you talk about suicide with your kids, they're going to go do it. If you talk about drugs and alcohol, they're going to go use. If you talk about sex education, they're going to go do these things. If you talk about financial things with patients, they're going to get all anxious and maybe not want to do it. No, not whatsoever. In fact, it's the opposite. It gives them peace of mind. And that price transparency gives them a confidence like, okay, we can do this as you lay it out for them. It actually eases concerns and reduces anxiety, doesn't it?
Well, you quoted the statistic. 95%
That's
of
right.
the financial records that we
Yeah.
clear prior to admission convert to an admission.
That's it right there. Yeah.
Like that's literally 10 times better than most of these facilities are converting on their own.
Sure. Yeah.
Right? That's number one. Number two, let's just use common sense. If the conversation and the money issues are in the rearview mirror by the time I walk through the front door to get my care, why would I leave early?
Right.
If I feel like I've already have paid,
Mhm.
why would I leave early?
Yeah.
Especially outpatient, where I don't know if you know this, but most people are familiar with this with physical rehabilitation. In physical rehabilitation, they say the most important part of physical therapy is the last 20% of the PT that you're getting. In other words, that's where the sustainability of
Mhm.
that care comes from. It's the last mile, right? But what do we all do? Oh, my shoulder feels fine. I don't need to go back to my physical therapist. I always find I laugh at myself when I do stuff like this. So I'll speak about me so I don't insult anybody. Like, how dumb am I that I never think the reason my shoulder feels
That's
better
exactly right.
is because I'm going to physical therapy,
Yeah.
right? And so outpatient treatment's sort of the same thing.
Mhm.
And I'm not ashamed to say I've been in recovery for a long time. And I still go to meetings a lot. And so that's one of the reasons I have a passion about behavioral health. And I say this to people all the time. The reason you're feeling better is because you're getting the treatment that you need.
That's right. You're doing right things.
And yeah, and if people leave early just because they're feeling better, what they don't realize is that, where you de-risk relapsing in behavioral health, where you de-risk triggers in mental health is the continuity of the care.
Yeah.
And so one of the reasons that people relapse a lot is financial stress, right? It's one of the 3 top reasons of relapse in
Absolutely.
behavioral health.
Yeah.
So why would a provider have a system in place, a patient financial management strategy that specifically is avoiding cost conversations, creating more anxiety and fear, and then calling people up when they're recently out of treatment, chasing them down for money and creating the very stress that, if you're in the industry, is in the top 3 reasons why they'll relapse.
Exactly
just
right.
don't understand it.
Yeah.
And some people think, here's something funny, Graham, you'll appreciate. There's this huge myth out there around compliance, for example. If I send a patient 3 statements, billing statements, I'm compliant with inducement laws. So let me make this really clear. No, you're not.
Hmm.
A collection effort, a regular and customary collection effort, which is the wording the statute has. Collection effort is statutorily defined term, right? It's a phone call. It's a letter. If you've ever seen a letter at the top in bold, it says the purpose of this letter is to collect the debt, and any information obtained will be used for that purpose. That's a collection effort. Is that how you want to treat your patients?
Right. Right.
In order to be, think about the absurdity. In order for me to be compliant, I've got to send this collection letter that causes stress to the very patient that I just treated when financial stress is the leading cause of relapse.
That's right.
So FinPay just decided we're going to move the paradigm to the front end of the cycle. And what we learned was 95% of the patients convert. This is what patients want, as evidenced by our 97% satisfaction score.
Yeah.
And the ultimate irony, Graham, is this. Most people that are in behavioral health have a marketing strategy to provide digital outreach to the world to let people know their programs exist and the quality of their programs and come. And so they're doing that because they know people use the internet and other sources of research to find them. Well, don't you think that same consumer is smart enough to know when they do that research that they're going to owe money? Don't they realize that consumer is going to know what is not being honest with them and transparent and upfront about cost?
Yeah.
So instead of playing the game, why don't you get ahead of it and be the one that eases the anxiety and the burden?
Yeah. I think one of the pieces that I really appreciate is that it is a relational model. It's not a business model first. By that, I mean, if you do the relational piece first, where you're talking about people, creating peace of mind, being transparent, understanding, that relational connection at the very beginning allows all the business things, all the provider services to take place. That relational model in all of our lives is critical. And we can probably have great satisfaction numbers and great success rates in the things that we're doing, less relapse, et cetera, when we do things from a relational point of view first. And I love that your company puts that right out there in front and has a conversation.
And we're not shy about that.
And
we're not shy.
I don't think you should be at all. Yeah, I think.
And here's the interesting connection.
Yeah.
In EMR, electronic medical records, electronic health records, does not provide care to the patient, right?
No.
The doctor does.
Yeah.
The clinician does. The therapist does.
Yeah.
The EMR is just the tool by which allows them to focus more on the patient's care,
right,
and less on other job functions that are a requirement of the care they're providing. Financial is no different.
Right.
What we're doing is empowering the healthcare provider to use technology to automate and create automation in workflow, automation in financial education, automation in the type of payment programs that you should be offering certain types of patients by using our risk stratification tool so that you can have a compassionate, right, and transparent conversation about cost in a way that makes the patient feel more comfortable and confident to come to your employee.
Yeah, I think that, like you said earlier, I think that's there should be no shyness around that whatsoever. That's the thing that is most exciting about what you're doing, and I'm very, very impressed. I know as we are talking about this and all the services you're providing, and with such clear explanations, which I appreciate. I also know we're kind of rounding the bend on our time here today. I'd love for our healthcare providers out there and who are interested maybe in this program, I'd love for them to know how to take some next steps in integrating FinPay solutions into their practices, as well as receiving. You guys also have a free patient financial management guide. Share with us how people can learn more about you, about FinPay, after they listen today, Chris.
Sure. So first, I'd have anyone ask themselves a couple simple questions. Do I have full visibility into how much money I'm owed a year by patients? And do I have any idea how much I'm getting paid from that?
That's a great question.
And as a result, do I even have an idea of what percentage of my revenue, total revenue, comes from the patient? you can't answer those 3 questions off the top of your head, they should call us. If they agree with what we've talked about today, that getting paid starts with knowing what you're owed and having an estimator tool that gives you visibility to that, then they should talk to us. If they believe the quality of census is good for the patient and good for the organization, and a risk assessment before they admit patients should be done financially, they should call us. And if they believe that an EMR was a good idea to invest in, to manage the clinical and automate the clinical experience, then electronic financial records probably make sense. They should call us. They can reach us at finpay.com, where there's all sorts of great information that they can learn. They can also submit a form and get access to us, and we'll reach out. My individual email is CW, my initials, at finpay.com. And on our website is also our 1-8, our toll-free number that they can call to reach us as well. We're passionate about this part of the business.
Yeah.
That probably came through a little bit. You and I was over talking a little bit, but I get real excited.
No, it's all good.
Because we're solving a $490 billion problem. 50 billion of that is in behavioral health. And the behavioral health, the average revenue recovery on that 50 billion is only 15%. And we're getting 75, 80.
Yeah, really.
So even if there's people out there that just are looking to grow their EBITDA to improve the financial health of their business, we're your first phone call.
That's fantastic. Well, clearly, with this clear explanation today, and I love the relational, patient-facing focus and the passion that's clearly there, man. It's fun to talk about this with you, and I love your heart around this. I think I can see very easily where you guys are transforming, healthcare here. And I think the important piece is also restoring trust in our healthcare system, because mistrust comes into play when there's a lack of clarity and confusion. So, Chris, it's been great to have you on the show today. Thank you for your time and all that you shared. And it's been great to have you with us.
Grant, the pleasure was absolutely mine. I really enjoyed it. I eat, breathe, and sleep this stuff, so I find it fun to do.
It is really fun to do it with you. Thanks again for being with us today.
Thank you.
Also want to thank you, our listeners, for joining Chris and me today. It's always great to have you with us. Regarding our episode, I want to remind you that it and its resources and all of our other shows can be found on our webpage at triadhq.com/BHT. Thanks again for being with us on the show, and we'll look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.